she's going to be helping us and really guiding us with our oral cares in our facility to try to make us one of the best providers in the area. Dr. Schuler, you ready?
Get a mic and everything. Sorry, I'm coming in hot. I had patients at 6:15 this morning, and no one in this town drives over the speed limit, so I apologize. I'm like, can we move this along? But anyway, I have a quick half an hour with you guys, and I could literally spend 4 hours talking to you about this. My name is Jackie Schuler. I'm a dentist in Sioux Falls. I was approached by Deb about being your dental director for your residents here, and it's funny, when she sent the email, I'm very busy, as we all are, right? We got jobs, we got kids, and I get the email and I'm like, I don't have time. And then this little voice was like, yeah, but if you don't have time, then who does? And you get a bunch of dental professionals together, and we'll complain about the status of elderly people's oral care. We'll tell you everything that's wrong. And I'm reading this email and I'm like, well, but if nobody does anything about it, then how in the world do we expect it to get better? So I meet with Deb, and I have to tell you, we met for lunch. I'm sure I was late for that too. And she's talking about all of you. And the way that she talked about all of you was truly cool and inspiring, and I think you guys need to hear it. She said that we're kind of like a family, and we really care about each other. There was something tragic that had happened that day. I don't remember what exactly it was, but it had really shaken her to the core, and she said, we really care about our people, and we really care about our residents. And that was neat to hear, and it's the same way I talk about my office staff. And that really drew me to Bethany. I felt like, okay, well, God, you put this in my life, and now I'm gonna say yes. I tried to come up with 12 reasons why to say no, and something kept telling me to say yes. And so here we are. And let's see, sorry, lost my spot. So I have one speed, and that is pedal to the metal. So we have had a couple of meetings, and I'm super excited to talk to you about some of the changes. Some of them are big, some of them are small, and the vision is very big. And so I'm just going to try to give you guys some tangible things that you're going to see changing and some tangible advice as to how to implement those changes. Bethany, I'm guessing in the intro that he talked about, Bethany is making dental care a priority for the residents here. There is a well-established link between our dental health and our overall health. And for the elderly population, that shows up in heart disease, and it shows up mainly in the nursing home population as pneumonia. If they culture the bacteria in people who have pneumonia, many times it's bacteria that lives in our mouth. And a lot of times elderly people end up passing away from complications related to pneumonia. So if we can clean up our mouth, we can literally help to save someone's life. And that's a big deal. The other thing that I always think about is that we all, and every resident here, very likely at some point took care of their teeth like you and I take care of our teeth. It's very likely that I, as a dentist, am going to end up in this type of a facility and relying on someone else to take care of my oral care. And I want that person to care as much about my teeth as I cared about my teeth when I was young. And I oftentimes think when I see these patients in my office of any kind, but of elderly population, that I cannot fix a lot of their ailments. I cannot fix a lot of their hurts. I can't fix their loneliness. I can't fix a lot of things, but I can fix their teeth. And so I think if when you're going in to do oral cares, if it seems like, oh, one more thing to do, but it's one thing that you can do to show that person that you care. The specific changes that you are going to see is I'm going to be coming in at least once a year, probably every 6 months, to do oral exams for anyone and everyone that will let me. This includes people without teeth. The guideline is even if you don't have teeth, you still need an oral cancer screening at least 1 time a year. So a lot of times people will think, "God, got my teeth pulled, got my dentures, I never have to see you again." And I'm like, whoa, whoa, slow your roll. You still get to come and see me once a year for an oral cancer screening. We'll be coming in to do x-rays, an exam, a fluoride varnish. My vision is to someday be able to actually clean their teeth while they're here and in this facility. But we're going to get a very accurate assessment of where we're at. And that is exciting for me because then my goal is next year, if I come back, if they'll let me, then I can say, here's where we were, here's what we've done, and here's where we've gone. Right now, we just don't know exactly what the status of everyone's teeth is. So that's step 1. We're going to be doing those oral exams. The other thing is your guys' daily oral care, which I think that is being done on them 2 times a day. I got from them like what is actually written out in your procedures manual, and it's really good. So if you haven't read it, read it because it's well thought out. Things I hadn't even thought of, like put a towel on them, like, oh yeah, that's so smart. Read it because it really, really does give you step by step instructions on how to do it effectively. One of the things that it says is to put lubricant on their lips. I have to tell you, in my dental practice, I come from a long family of dentists, and my grandfather was a dentist, and he had 3 rules when as his children were joining the practice, and then those got passed down to me as I was joining the practice. And one of those rules is every single patient gets Aquaphor on their lips prior to being worked on. And I cannot tell you the number of patients who say, "Thank you so much for doing that. No other dentist I've ever been to does that." And so that is so important. It seems so little, but it prevents those lips from cracking and hurting as you're brushing those teeth. I would also say lubricant on the lips prior, lubricant on the lips after, because you're going to wipe it all off, right? And so many of our elderly patients have dry mouths, they have dry lips. So if you can reapply that lubricant when you're done, I think it makes a world of difference. The recommendation or the step-by-step procedures talk about using a toothette, dipping that in mouthwash and rubbing it on the teeth. I would say if you're doing the oral care and if the resident will allow, try to use a toothbrush. A toothbrush is better than a toothette. A toothette is better than nothing. But try to use a toothbrush with just a little bit of toothpaste on it. And then try this at home on yourself and try it when you're at work. 2 minutes of brushing. Set a timer on your phone the next time you brush your teeth. You didn't do it for 2 minutes, I can guarantee it, okay? So it's a long time. It feels like forever if you actually set a timer and do it. But if they are allowing you to do so, spending that time is going to increase the chances of you actually getting all of the plaque and schmutz and food off of the teeth, okay? Then letting them spit or rinse with a glass of water. And then I would say dip the toothette in the mouthwash and give them a little freshening up with the mouthwash, okay? They won't allow for the toothbrush, then doing as best you can with the toothette, but always trying to do that 2-minute period of time. One little pointer that we use at our office a lot, and sometimes they're not communicative, sometimes we're dealing with memory issues, and so it's hard. Sometimes you'll go, okay, we're gonna brush your teeth, and they're like, right? Open your mouth. If you put pressure on their chin, like right in the little dimple of your chin, if you put pressure there for about, 20, 30 seconds, I'll just put my hand on there and I'm talking to them and doing my little song and dance and they're like, and I just keep pushing here And then I let go and I open my mouth. And what happens is they open their mouth too. Now you gotta be quick, right? Because they're not gonna stay open forever. So you gotta be ready with that toothbrush to get in there when they open. Now the finger goes back on the chin to help to keep it open, okay? But that letting go and opening really does, it's like, I don't know why it happens. I'm sure someone does that's smarter than me, but it actually does work. The other thing that I, sometimes if they are not super cooperative, the other thing that I've found is that if you count to 10 and give them a break, a lot of times that allows them to feel like they have some autonomy in this and that they only have to do it for 10 seconds and then they're gonna get a break. We've done this, I mean, not just for brushing teeth, but for prepping a crown or for pulling a tooth or for so many things, and we'll just count, and sometimes I count faster and sometimes I count slower. But if you count to 10 and then give them a break, okay, you ready again? We're gonna do 10 again. And that seems to help that incremental where they don't feel quite as overwhelmed. If they are doing the oral care, obviously that is preferred, if they can, that they're brushing their teeth. Time it. Try to encourage them to keep going for that 2 minutes because they're just like us and they don't do it for 2 minutes. So time it, watch them, and try to encourage them. Like, I mean, I do this with kids in my office all the time. Well, did you get the back teeth? Did you get the tongue? Did you get the cheek? Did you get up along the roof of the mouth? You know, like trying to encourage that, or trying to encourage so that they are getting all the surfaces of the teeth. Oftentimes in an elderly population, it's hard for them to grip a toothbrush. They have arthritis or something that prevents their hands, or Parkinson's prevents their hands from gripping that small toothbrush handle. Get OT involved if you can, or if you can't, contact me and I'll send for an OT consult because they have a lot of different ways that they can help those patients to maintain their autonomy and stay brushing their teeth. There's lots of different attachments we can add to the toothbrush and things like that. So don't be afraid if they're having difficulties to help them through that process and get OT involved if we need to. Does anyone have questions about oral care, like the daily oral care? That's kind of the nuts and bolts of what you guys are doing each and every day, and a big part of what is going to make this successful. Nope? Got it? Okay, perfect. The other thing that we are going to start doing is fluoride applications on our patient, fluoride varnish applications on the residents 4 times a year while they're here. Fluoride is an ion that we use. The teeth suck up that fluoride, and it makes them stronger, more resistant to decay than they were before. So a lot of these patients have a lot of different medications, which oftentimes cause dry mouth. And when we lose both the quantity and the quality of our spit, our decay rate can shoot through the roof. And so fluoride is kind of the one thing that we have in our arsenal that's super easy to apply and that helps as much as we can to keep that risk of decay down. So we're going to start those varnishes 4 times a year. I think specific people are going to get to spend some more quality time with me so that we can train how to do those applications. Then the goal is, so we've done the examination, now their teeth are getting brushed sparkly clean every day, they're getting their fluoride, now they have work that needs to be done. So then we're going to start taking a more active role in working with those families on trying to get them into their dentist so that we can get those decay rates down. I would love, and I don't know, just because in my own office I get to do my own thing, so I don't know how it exactly works here, but documenting the refusal of oral care is super valuable information. And it's information that we're going to try to start communicating with the dentists as they're going out, because what happens if I'm seeing a patient in my office, they get dropped off by paratransit, they come with this envelope, right? And in that envelope is a med sheet, and that's it. And then that patient opens their mouth and they have plaque everywhere. What's my initial thought? That Bethany, they don't brush their teeth, right? So, but what if you are? What if you're trying 2 times a day, every day to brush this patient's teeth? How great would that be to have communicated to the dentist that this patient denies oral care 90% of the time? That first of all makes me think, wow, they're paying attention. They're trying to do this and this patient isn't allowing it for whatever reason it might be. But it also impacts how I'm going to treatment plan that patient, right? So if they have an area that we have a significant amount of decay and I'm going to try, cross my fingers, to put in a really large restoration, well, but I know they're not going to take care of that. So then I'm going to think, okay, maybe we should remove this tooth so that we don't end back up here 6 months from now when they haven't brushed their teeth, okay? So documenting that refusal of care is then going to be transcribed in a different form that someone magically is going to fill out, that is going to go to the dental offices with them that is receiving that care. The other information that we're going to be communicating is if they're their own guardian, and if they're not, who is. And the other thing is like a direct line or a direct call for who the dentist can call if there's questions during that appointment. Because when I'm seeing someone in my office, it's a very busy practice. If I have to leave that room and go make a phone call and get put on hold and talk to this nurse and then talk to this nurse, I'm like mad by the time 7 minutes has gone by and I have a simple question about the patient, okay? So we're gonna try to make sure that other people know, other dentists know, other facilities know when the Bethany patients are leaving this facility and gonna be treated elsewhere. We're gonna try to make that as easy as we possibly can for those other professionals to be involved in the care. The other thing that you may see, okay, good, I'm okay on time. The other thing that you may see as I'm doing their oral evaluations, one thing, looping back to that dry mouth, one thing that I will likely be writing prescriptions for is fluoride gel for a lot of these patients. The fluoride gel that their insurance covers is something called SF 5000 1.1% gel. And that is applied after the brushing is accomplished. So it's not a toothpaste. But you'll do the oral care, you'll put a little bit of this on the toothette and rub it on the teeth and then let it stay on the teeth. We don't want them to rinse or anything like that. So that might be a new prescription that you're seeing come through on a lot more patients. Same thing, what's the one thing in our arsenal to try to prevent decay? Fluoride. So I'm just gonna inundate these people with fluoride day in and day out as best as I can, okay? The other things I wanted to touch on were dental emergencies, and mainly what is a dental emergency. I am available for you to call at any time, day or night. The powers that be, I think, have my cell phone number directly. You can always get a hold of me. If you call my office and leave a message, it calls my cell phone. So if we do have a dental emergency, I certainly want to know about it. But one call, and we actually just got it a couple days ago, a resident woke up with blood on their pillow, right? Is that a dental emergency? Anyone? No, it's not a dental emergency, but what is it? It's not just an ignore it. What it actually is a referral to the medical doctor for a blood workup. Because a lot of these patients are on blood thinners of different kinds. And so if their gum tissues are spontaneously bleeding at nighttime, that is an indication that their blood thinning medication may not be at a correct dose. So that's actually a call to the medical doctor. If you call me, I will say that with a smile on my face. I will not get mad. But that is first a call to the medical doctor and then a call to the dentist. Because it may be that there's something going on, but more important that we check out that blood thinner, okay? What is a dental emergency? Swelling. That is a sign of an infection. That shouldn't be news to anyone in this room. Swelling is a sign that is a sign of a dental infection, and that patient needs to be seen or at least consulted within that 24-hour period. We need to either start some type of antibiotics or do some type of treatment on that patient. So that's when, if it is a weekend, if it is a Saturday, please don't hesitate to call me because I would way rather place that patient on an antibiotic over the phone than I would have them seen on Monday after we have some bigger problems. Broken tooth is a moderate dental emergency, right? None of us want to walk around with a broken tooth. If it's sharp, I don't know if anyone's ever broke their tooth in here and had a sharp spot, but it's brutal. I mean, the sores that people have on their tongues after just like 4 hours of a broken tooth, it's brutal. So if it's sharp, if the resident is complaining that their tongue's hurting, or sometimes they'll be talking and they'll be like this, right? That hurts. So yeah, we need to see them. We need to get that figured out. We need to get that tooth at least smoothed off for that resident. If it's not sharp, no, it's not a dental emergency at all. Something certainly that should be addressed, but it is not something that we need to see them that day for. A lot of times I'll get the call that I have this like black hole in my tooth, right? Or it wasn't there yesterday, but it is there today. And the answer to that is it was there yesterday, you just noticed it today. So that is very seldom something that is of urgent demand. It is something that, yes, we want to know about, but it is not something that we have to know about or see right away that day. Okay? Do you guys see anything else that I am not addressing as far as when you wonder if you should call a dentist? No? Okay. The other thing that I will leave you with is sometimes these patients are difficult. And sometimes, oh, sorry, go ahead.
You're good, 5 minutes.
Oh, I'm gonna get buzzed off stage here. Okay. Sometimes these patients are difficult, and sometimes it isn't fun. I have so many times patients come in and they're like, I don't know how you do what you do all day. And you think about it, yep, I'm bathed in spit and dirt and plaque all day long. Like, that is not a great job. But if you, I try to have two mentalities as I'm treating my patients, and anytime I have to talk, I try to leave people with this mentality because I think they're so important, and I stole them from other people. The first one is I went to a lecture, his name is Dr. Gregory Fultz, and he actually does a ton of nursing home dentistry. It was a geriatric dental lecture. And he talked about, the patient comes in or you go into their room to do their oral care and they're mad or they're cranky and they got plaque everywhere and they just ate breakfast and you're pretty sure that like their supper from the night before is still on their teeth, and that is not fun. And he would say, doctor up, right? Now, we're all little doctors. And we all have these opportunities in not just oral care, but in all of the care for these residents to doctor up, to do what you're supposed to do to make a difference for that patient. So I cannot tell you the number of times that I think to myself, this is it, doctor up, right? Thing number 2 was, I heard it on Oprah back before she was off the air. And it was an interview that she gave, or that a woman she was interviewing this woman who was like a neuroscientist, super smart. And she had had a stroke when she was 30 years old. And she knew, because she was like a brain scientist person, she knew what was happening as it was happening. And so she knew that she was having a stroke and was able to get help and woke up essentially in the hospital and had lost all ability to talk, had lost all ability to understand who this person was. She didn't know that her mom was her mom. She didn't know that the doctor was a doctor. She had lost all like logical thought and ability to communicate. And she talked about what she did have was her ability to interpret emotions and her ability to interpret people's moods. She knew, although she couldn't put the word to her mom, that this person loved her, even though she couldn't put the word to love, but there was something special and different about the way that this person interacted with her versus a doctor that came in and was hurried and she didn't get that feeling from him. And so I think about that often when I'm seeing patients who aren't communicative, who are difficult. I think that there is still the ability for them to emotionally know if you care and if you are on their side. And I say it out loud probably 10 times a day. I say it to almost every elderly patient that I see, and I think it probably 30 times a day. I say, my name is Dr. Schuler, and I am here to help you. And I think if you go into a room, if you're gonna start oral care and you're like, ugh, don't wanna do this. If you can think to yourself, time to doctor up, and my name is so-and-so, and I am here to help you, you will be well received. I am super excited to start this journey with Bethany. You guys probably all think I'm crazy, but I'm super excited to start this journey with Bethany. I can't do it all on my own. The reality is it won't go anywhere if you guys aren't vested in it and if that day-to-day care isn't a priority. So I'm begging you, hoping, and trying to inspire you to make that a priority for our residents here. Does anyone have any questions before they run me off the stage? All right, good deal.
Thank you so much. We are also super excited that you answered the call.
Yeah.
So many of us feel, right, that we've been called to our work at Bethany. Dr. Schuler has that same call on her heart, and we're so happy to welcome you to our Bethany family. Let's give her another round of applause. This was awesome. Let's back her up. Thank you.
Okay, thanks guys.
Thank you.
Bye. Bye.